before we begin serving the facility, we first of all do an aerial survey of the facility. Once we get the coordinates for where they decide they want us to drop their packages, then we'll map out the route from here to that delivery site. After which the management of the facility will then give us those who are authorized to order products on their behalf, because we don't want to circumvent the current system they have in place at the health facility. So once we have that data, we feed all of that into our system. So based on that, if we receive an order, we would input the health facility into the system, and then we get all those who are authorized to order. If you are not authorized in the system, you can't process that order. However, in cases where there are new people at the facility because of the changeovers, for each facility we have someone who alerts us, okay, this is a new person that's actually mandated to order on our behalf. So once that is done, then we go ahead and process the order. So once that is also sorted, we receive orders in two main ways: through our call center, a toll-free number, and then via WhatsApp. And for those who have network communications issues, mostly text messages. When we receive an order, we would communicate back to the facility via those means as well. We will send them notifications. We send them notifications when the product is available or not available, how much we can give them based on the order limit we've agreed with the RMS. So in everything we do, we deal directly with the RMSs we pick products from. So we pick from both the central RMS and then the eastern RMS, as well as the National Blood Service for blood, and then the EPI for the vaccines and the vaccine consumables. So if you are mandated to order that product per your health facility level, according to the NHI classifications, then we'll serve you. If you are not, the system will block that order from being processed in the first place, so as to ensure that the systems that are in place, as if they were picking products from the RMS, is still the same chain of continuum and reporting that exists. So once we process the order, we would alert them once the drone leaves here with the estimated time of arrival. We would alert them 5 minutes to when the package is about to deliver. And when the package is also released from the drone, we would alert you. And then check back to make sure that you've received your package and everything is in order. From time to time, we also pay the facility visits to see how they are faring about the service and where we can get improvements from. So once we receive the products from the various RMSs or API, we will check to make sure the expiry dates are within a sizable amount of time. We don't want to bring the products here only for them to expire here as well. That defeats the purpose of the whole program in the first place. Once we do that and we check to make sure expiry dates, product quality, and everything are in order, we will receive them into our system. So for every product in the warehouse, we have attached on them unique barcodes. Now on these barcodes, we have the expiry date, the supplier, the product, the batch number. So it allows for us to easily do any recall if the FDA issues any recall for any particular product or brand that there may be an issue with. And before the product will also leave the warehouse, you have to scan it into the system to ensure that that product matches the order.
What are we doing currently? Are we within the 80 or we are benefiting from
expansion? So the Zipline Distribution Centre has pushed beyond 80
But here we are still 80.
Here for the facility we serve currently within the 80-kilometer area.
So what do you mean from here, you can go as far as 80 kilometers?
But that is
all directions.
The air. So just to give you an idea, from here we can reach 80.
You can reach
Yes, we can reach 80,
so
which is a front plains. Yes.
We need permission.
Sorry?
We need permission.
No, so we actually were serving HA from here up until we brought up the MoH Distribution Centre. And then we situated the distribution centre so that it reduces the flight time to the health facility. Because if I'll fly maybe 45 minutes to get to HA, and somebody will fly 15 minutes, then it's best to move the service to HA to that facility that's closer, just to reduce the flight time for the health facilities.
Your system with the gamers, how far has that one gone? That's the first question. Two, your relationship with the RMS, the regional directors and the district, and the chief is here. How far is it also going? Then thirdly, your product lines. You know, you mentioned the vaccine, but I want you to be specific exactly because we saw Omenako here, antimalarials. Is it part of your listen? So that at least now that chief is here and all the policymakers are here, will be clear as to what you are supposed to do and what you are not supposed to do. Their products. Yes.
We have the contacts of the accountants at RMSs. The district health directors, we have somebody specifically that deals with engaging them on a regular basis, just to ensure that they are always in the know. So we visit them on a regular basis, myself or that person tasked with ensuring that whatever the district needs, we are taking care of that need, because we are really here to serve them. And the regional directors as well, we engage them constantly. Kwesi, myself, Rejoice, we constantly engage them, send reports to them, have meetings with them, just to make sure that anything we are doing, it's in line with the direction they want for that region, because we are guests in their house, so to speak. So we have a very good rapport and working relationship with the various stakeholders.
But it also offers stakeholders at the national level the visibility of our operations. So I think it's a critical part of anything that we do in terms of policy. The bit about our product portfolio. So here we actually centralize medical products, blood products, and vaccines. I think during COVID we started COVID vaccines and also COVID samples. And then the medical products, we actually deliver emergency products and some routine products as well. The idea being that we run two use cases to a large extent. We have the emergency use case and then we have the resupply use case. So the emergency use case is when you have a patient at a facility needing an emergency product, an anti-snake or an anti-rabies or a blood product. So in that instance, you staff the drone with just that particular product to deliver to the facility to save the patient's life. Then we also have the resupply use case, where you have a facility going low on stock or totally out of stock. The regional medical stores will usually have like a 3-month cycle when it comes to its last mile distribution. But in between that process, sometimes you have facilities, particularly in the hard-to-reach areas, running out of stock or even going low on stock. And it takes a while for them to actually refill. So in those instances, we deliver controlled quantities of those products to them to help them get by onto the regional medical stores, refills for them. So they might order for a few packs of anti-malaria just to get by until the regional medical store delivers the entire bulk to them. So that's why you see like a Lofnac here, you see an anti-malaria here and there.
The battery is 99%. Estimated time of arrival to Gomoadasun, 34 minutes, 37 seconds. I see a lot of flight-related information, altitude, airspeed, GPS quality, and if there are any issues, it's also going to tell me that it has had technical issues and it's going to return for us to have another drone on the way.
So if there are problems, you can even print this out to be able to determine.
All that information is also logged. So everything is logged here.
We are excited to host the Ministry of Health here at Zipline Omenako today to deepen our collaboration with the ministry. Zipline has been in operation since 2019. This is one of our 6 distribution centers scattered across the country. We've had a very interesting journey with the Ministry of Health, and we've had a lot of learnings from that particular partnership. We are happy that the Ministry of Health is here today to share feedback on our operations so far and also give us insight into how we can better improve the collaboration that we have with the institution. So far we have 6 distribution centers scattered across the country. From these distribution centers we serve close to 3,000 facilities, with 50% of them being in very hard to reach areas. We've helped to minimize stockouts in some of the facilities that we serve by delivering controlled quantities of the products we receive from the ministry to some of these facilities. We've also helped to improve emergency response to these facilities. Now you could have a facility having a pregnant woman in the middle of the night needing blood products, but the facility still being able to see to this particular pregnant woman through aerial deliveries of blood products using drones. So we've also helped to enhance and improve response to disasters across the country. There was one instance in the Northeast region where we supported the regional medical stores to distribute medical products and also other kinds of products to facilities that were cut off during the rainy season in the northern region. It helped to manage some of the disease cases that they had in these areas, and it also helped to minimize some of the challenges that these regional medical stores had in distributing products to some of these cut-off facilities during the rainy season.
We needed to pay a working visit to Zipline facility to see how they are meeting us halfway to achieve our goals of making medicines and other important health products accessible to patients. Our main goal is towards universal health coverage. So along the line, the partners we need to help us support to do these things. Regularly, it's important to touch base with them, see what is going on, touch base with reality on their challenges. Then we use that to strategize them more. So our coming here, getting closer to the challenge, like I said earlier, makes us feel a part of it, and we share in their concerns and also their successes in also meeting us halfway in delivering products to the communities, especially the hard to reach areas, areas that we know is a challenge that we cannot. And I think we are impressed so far. They are very professional in nature. The place is beautiful. The technology is great. Indeed, it's exciting to watch and to also see that they are really helping and saving lives. I think it's a good thing. We need to support through and through. It's a private sector collaboration, yes, but it also brings us closer to improving our public-private partnerships in some of these things as we move closer to achieving our universal health coverage goal that we have set ourselves to do. I am happy, very impressive, and I would really want to come here unannounced once to see if it's not stage managed, but the cleanliness, the professionalism, and the way they go about their things is up, so that we can continuously engage them to help us do the needful.